Hey guys, it's Maggie and I am back today with a video that I asked you guys if you were interested in not that long ago, and that's how to heal anal incision wounds. Now, the reason I'm making this is because I feel like this information might be helpful to more people than just those who had their rectums removed and their anuses sewn shut. That area is a very difficult area to heal, so there are a number of reasons people may have incisions or wounds down there, and I thought that this information might be helpful to you. Anytime I share about my lack of anus, I get questions. So I have Crohn's disease, an autoimmune illness of the GI tract. It really just wreaked havoc on my colon and rectum. So I decided in 2019 to evict them, which means that my anus was sewn shut because of it. It sounds wild, it's really neat looking, and people are often surprised that you can survive and have this done. I now live with a permanent ostomy. It means my small intestine comes out of my abdomen about an inch, and I wear a plastic adhesive bag. That is how I go number 2. I still urinate the old-fashioned way. Nothing was messed with that, but with this surgery, I really struggled to get the wound to heal. I knew that that was going to be an issue before I even had the procedure done. People just have a lot of issues with wounds that are in dark, not airy spaces. I think it's important before we dive into the products that I used and the methods that I used to heal this thing, I think it's important to mention that I am an RN, but I do not currently practice bedside or in a normal manner. And while I did go to wound ostomy continence school for like half a second, I am not a wound nurse. I'm not an ostomy nurse. Do I have a lot of experience with them? I would say so, but I am not an expert by any means. And anytime you're dealing with wounds, you should really see the experts. See a WOCN for your wound needs. Now, in giving that disclaimer, after my surgery, I felt like I received excellent care, but I was never referred to a WOCN. I never saw a wound nurse, and looking back, I think I should have. I realized that there are lapses in care and things are not always done perfectly. There are limited resources out there, which is why I am making this video. It is for the patient that is just searching for answers, searching for possible solutions that they can bring back to their provider and ask, do you think this will work for me? And dare I say, online, on the channel in which I talk about ostomies, I think that I like wound care more than ostomy care. I know. But I have had a lot of personal experience with wounds. I had my abdominal incision when I first got my ostomy. I had that dehiss, which just means that the wound edges split open on me and it had to heal inside out, which is why I sort of have a little bit of a canyon going on in my tummy. And working bedside, when I did work as a bedside nurse, I loved caring for all things skin. I loved helping kids with their G-tube skin irritation and their wounds that had dehisced. And of course, along with that, I loved helping the kids with their ostomy care. So yes, I have a lot of interest in wound care. I think it's fabulous. And you get to be so creative with how you manage them. There's so many different ways to manage wounds. You think it's just like messed up skin. They're so complicated and I love it. So when I wound up having my own anal incision that needed to heal and it was struggling to heal, I kind of used my knowledge that I gained from being a nurse, from going to 2 seconds of WOCN school, and I applied them to myself. I was like, okay, I have some of the knowledge. Let's try to get this thing closed up. And my incision actually started off really great. I had stitches, I had real stitches, not dissolvable. My surgeon wanted to keep them in fairly long. I mean, I know that there are other people who have had them longer, but I had them, I believe, about a month, which was very hard because real stitches that don't dissolve are painful. They pull. Anytime you move, you feel them just, it feels like it's tearing it apart. And you do not realize how much your butt cheeks move until you have the surgery and you have stitches in place. It was rough, but I had the stitches removed about a month after surgery. I think it was about a month, maybe 3 weeks after surgery. And it seemed like everything was going great. It stayed closed, there wasn't a lot of drainage. And then I had a work trip to California, in which it was a 6-hour flight because I'm flying from Philadelphia. So obviously I was sitting and I tried to do all the things, I rolled up my jacket to give myself a little bit of cushion and I wasn't sitting directly on the wound. But then we had a lot of meetings in which we were sitting on chairs at that work trip, and it wound up splitting during that trip. I remember the exact moment that it split. I was with somebody who also had had that surgery previously, and I remember feeling it and going, oh my God, I think it just split. So when I got back to my hotel that night, I took a mirror to my butt, and it had in fact split open a little bit. After that, I had a decent amount of trouble with it. It was draining a lot of serosanguinous fluid. It was like this clear, sometimes tinged with a little bit of blood, not much. It really was mainly clear. It just felt like it was constantly draining. I wound up going back to my surgeon multiple times and being like, I can't get this thing to heal. I don't know what's going on. And that's the thing about wounds like this is there's kind of a perfect balance where you want there to be some moisture that helps the epithelial cells heal over and take over the wound, but at the same time, you don't want it to be too moist and have too much fluid collecting on it, because that kind of harbors bacteria, and then you can grow biofilms that are really hard to get rid of, and it's a delicate balance, and I was trying to find that balance on my own. I really had to get comfortable looking at my incision closely, touching it, obviously minimally touching it with sterile Q-tips, but I had to get really comfortable with it because I needed to get a good look at it, and so I found a very specific method on how to do this. I've shared this before. I took a makeup mirror that tilts, you can kind of tilt it, and it had a magnified side. I would set it up on the toilet, and it would reflect the light from the bathroom lights up into my tush, and it lit up the incision so I could see it really well, and I would often use the magnified side so I could see a little bit clearer. After it split open a bit, I realized what it kind of looked like was, if you imagine a sink basin with a drain at the bottom, a hole at the bottom, that's sort of what my wound looked like. It looked like it had a nice healthy red, pink bed, but there was a hole at the bottom of it. And that's where a lot of the fluid was coming from. Now, I had mentioned, I think pretty recently, that I had a CT scan to see if I had a rectovaginal fistula going on. That was a whole other video. I think it was my pooling periods video. That CT scan, while it did not show a fistula, it actually showed a small fluid collection right around the area of that hole, that thing that looked like a drain. It wasn't quite an abscess, it was just a small collection of fluid. So I think that's where that fluid was coming from. So I needed to find a way to collect the fluid while not completely drying out the wound bed. When you have holes or tunnelings in wounds, oftentimes in the office, a surgeon or a WOCN, whoever, will measure it, and they will use different tools to get to the bottom of the wound so they can measure its healing. Obviously, I was not going to do that at home. That is risky because you can damage things. Sometimes it requires taking some sort of Q-tip or other device and sticking it into, the tunnel and seeing how deep it goes. Not something you do at home. So I was less worried about that. I figured if this is a very serious tunneling, I'm not going to be able to resolve that on my own, and I'll figure that out pretty soon if I can't get the wound to heal. So I had a few different issues with this wound that I really had to address. Like I said, it was a very productive wound. It did have a lot of drainage, and I needed to figure out a product that would work for me, that would absorb enough of the fluid but not dry out the wound, that wouldn't leave little pieces of gauze stuck in the wound because it was still kind of deep. You don't want pieces of gauze to break off and then it heal into the wound, because then later on it'll break back open as your skin tries to expel that. And so I went back to my nursing days and I'm like, what products would we have used in the hospital. And so I started to do a little bit of research. If I look a little different, it's because I had to run upstairs and grab the product that I used. So I found alginate dressings. And what I really loved about this was that you were able to cut them into different sizes and different lengths, kind of customize them for your wound. I would buy them in a rope form. It was like a long version of it, and I would actually cut that into halves or thirds, so it was like a little snake. And then what I would do was take a sterile Q-tip and help push it into the wound. I would try to get it as carefully but as far as I could into the wound bed. And what was really great about this was it absorbed the fluid perfectly, but it kind of turned into a gel. Even though it turned into this gel though, that still sort of kept the wound bed moist, which is what epithelial cells kind of need to heal over. It was not breaking apart, so I could pull out the edge of the rope and it would kind of snake out of the wound bed when I would go to change it. That stuff was absolutely amazing. It really helped to just pull all that excess fluid out while still maintaining a damp area for the cells to heal. I found that to be a lot better than typical gauze, which was leaving little, stringy bits of gauze and I don't know, like fluff in the wound. This just came out in one piece, and it definitely absorbed more than gauze did. Another issue arose though, and this is pretty common with wounds, in that they often tend to stall in their healing. It's very annoying because you feel like you're making some progress, your wound is looking better, it's getting smaller, and what typically happens is the wound heals from the outside in. The epithelial cells will grow inwards and cover the wound bed, but sometimes the wound edges kind of roll over on themselves, and then it stalls the healing process. So there was stuff that I could do at home to an extent, but this was something I couldn't fully handle on my own. As I continued to go back to my surgeon, complaining about this wound not healing, something that he did was he silver nitrated the area, essentially damaging it on purpose. It kind of wakes up the wound so it can continue healing. It is a bit of a painful process. It's something that they can do around stomas for ostomies. If you get things like granulomas, it's little kind of round tissue pieces, you can kind of burn them off. That's sort of what we did, but on the wound edges. And it had another effect, actually, when I got the silver nitrate done. He was pretty aggressive with the silver nitrate, and it woke up the wound, but what it also did, I think he must have gotten the bottom of it, because the day that he did that, I had so much drainage come out, and then suddenly the drainage calmed down and I had a heck of a lot less of it. So that was really helpful. I think he must have gotten to that little area, that little collection of fluid, and it finally allowed it to drain out, which was awesome. But the silver nitrate definitely woke the wound back up, but I was still worried about it kind of going through a cycle of waking back up and then kind of stalling again. So I was like, all right, what can I do at home to continue with this progress that I'm making? And so I started to look into different products and, went through my wound school textbook, and I remembered Manuka honey. I know what you're thinking. You're like, honey? It's medical grade honey, but it is honey. It's sweet. If you ate it, it tastes sweet. I wouldn't recommend eating it because it's really expensive. Just go to the grocery store and buy yourself honey, but don't use grocery store honey in your wounds. I started off by going online and finding Manuka honey infused dressings. Very similar to the alginate. It may have actually been alginate infused with Manuka honey. I'm not sure. I don't quite remember. But I started off with that. Similar kind of thing to the alginate. I could cut it into different pieces that would fit perfectly in the wound, and the honey actually kept the wound active. It kind of helped to break down the unhealthy skin and keep it going, keep it trying to heal. And I'll post a link in the description so that way you guys can see an article about why Manuka honey works. It's fascinating. I keep it on hand now because, with my Humira, I tend not to heal very fast, and I'm like, if I ever get a cut or anything, I'm using Manuka honey on it. But yes, this stuff was amazing. I would place the little dressing with the Manuka honey into the wound, and then I would add some gauze on top of that. Now, I did find an issue with this. this sort of dressing, this infused dressing, tended to melt. And that became a problem as I got more active after surgery. It wasn't so much a big deal when I was just home and relaxing, but the dressing would sort of melt. The honey would melt out of it, and it would leak onto the gauze. It would go through the gauze, and it would just go all over me. So go on my underwear, it would seep through into my clothes. It's like I can't, once I'm back to my regular activity, I can't really, have that happening too much. So I had seen how effective the Manuka honey was. It was keeping the wound active, and I could actually feel it working. I could feel it sort of like tingling or burning the wound bed, which was an odd sensation. It wasn't horrible. It wasn't, extremely painful, but I could feel tingling, and I could see the wound getting smaller and smaller. So I knew it was working. But I wanted to explore other options. At this point, the wound was starting to fill in. It wasn't so much of a deep sink with a hole at the bottom. The hole had kind of filled in and the wound was getting a lot more shallow. So I wasn't so concerned with gauze and the little fluffies healing onto the wound bed because I could see all of the wound. So I went back online searching for more products with Manuka honey in it, and I found just Manuka honey gel. Came in a tube, was fabulous, and that, for whatever reason, did not seem to leak or melt the way the infused dressings did. So I took some regular old gauze. I would place a little bit of the Manuka honey right on the gauze, and then I would press it into the wound, and that would be that. And thankfully, the area that it was, because it's between the cheeks, I didn't need to tape it into place. It kind of just stayed in there on its own. So my routine for a really long time was waking up in the morning, getting in the shower, letting the water run over the wound without any dressing in it, and then getting out of the shower, setting up my mirror on the toilet, letting my skin dry, letting the wound dry, and placing my Manuka honey dressing in there. And then at night, I would kind of do the same thing without taking another shower. I would change out the dressing, check it out, make sure everything looked good. And I went on like that for a really long time until I got to a point where it had healed enough where I didn't need to do any dressing. And the funny thing about wounds is, there's that initial wound healing period where you see the red tissue and it's open. And then there's this point, and I only know this because of my own abdominal incision. There's this period of a couple years where your incision sort of fills in. And I notice that even now, I see how shallow my abdominal incision became over the years as opposed to when I first had it. I mean, it was a huge canyon when I first had it. I have noticed the same thing on my bottom. It has continued to get more and more shallow. It's still kind of like I described in my what not having an anus looks and feels like. It's just sort of like a divot, and there's no hole at the bottom where there used to be. I really wanted to share this because when you have an incision or a wound in such a sensitive area, you will try just about anything to get the dang thing to heal. I remember the summer after I got this surgery and it was still kind of open, I was out on our back porch, mind you, like in a private area, but I was out on our back porch with my butt up in the air so I could get some sun on it because I thought maybe some sunlight would help this. I stopped that when we realized people were flying over our house and taking photos. Story for another day. But yes, I stopped that in the fall and just, did dressings and stuff to get it to heal. But I understand how sensitive it can be. There are people that get episiotomies and things of that nature that, gosh, it's just a painful area. It's a painful area to have incisions like this. So if this helps you at all, I will link the products that I used below. Don't be afraid, though, to keep bugging your surgeon. Ask for a wound nurse if you're having trouble with your wounds healing. It makes me wonder for those who, had vaginal deliveries and had episiotomies. Do they offer wound care to you? Do they offer a WOCN to you? My guess is probably not too often, but I wish that it was more available. I know that a lot of hospitals only have like 1 or 2 WOCNs. My hospital, I think, what do they have? 2 or 3, I believe. And they were used to the max. They were very busy. So yes, hopefully this video is helpful for some of you. Thank you so much for watching, and I will see you in the next. Bye, guys.